So just let me know when it is live.
Sir. Over to you, Ajay sir.
Good evening, everybody. Dr. Smith, as always, is the foundation on which our entire program goes, and it's a great pleasure to be on the same podium with him at any forum. And this is what a humble effort on behalf of all of us. Obviously, mostly conceived and executed by Dr. Smith. There is no other word for it. We are very happy to participate. And in today's series of the pioneers of PGI, we're going to speak about Dr. Koshi, Dr. Bahulian, Dr. Kohli, and Dr. Mann. And the usual program is that we have a small video about small background, and then we hand it over to the 4 participants. And as many as are available, they can interact, and people can ask what they want to. We'll make it as interactive as possible, as always.
Sure.
So, over to you, Dr. Smith.
So Rohit, Ritesh, we can play Dr. Koshi's video and then we'll.
Okay, sir. Sir, is it visible to everyone?
Yeah, it is visible. It is very visible. No, it is, the video has gone.
Ritesh, you have to restart it.
I think I played a different video. I played another video. I'm just putting it on again.
Wonderful.
Oh, thank you. Thank you so much. Thank you.
So we'd like to have you share. You can share some anecdotal happenings
Surely.
at PGI. Yeah.
Definitely. So first of all, I would like to thank Dr. Smith and Dr. Ajay and all my PGI alumni members for arranging a platform like this one to honor the old batches of the DM trainees. I am extremely happy and privileged to be here this evening with you all. Here at the outset, I would like to pay homage to the souls of my dear teachers who have gone to heavenly abode, namely Professor P.L. Wahi, Professor P.S. Bidwai, and Professor H.N. Khatri. Now, talking briefly about my experience at PGI, my mind goes back to those wonderful days when I did both my MD and DM at PGI. Since I did my MD also at PGI, I had a long stay at PGI. If I am asked to say about my experience at PGI in 3 words, then I'll put it as the most wonderful period in my life. I went to PGI in June 1977 for my selection examination for MD. I still remember and always cherish a memorable incident which happened during my selection examination. You know that during those periods, during the selection examination, we had a practical exam also with the 4 short cases, apart from the written exam. And there was no need to take any history because we people are coming from faraway places and we were not very familiar with the languages. So what will be written is that on that particular code, there will be a small note as to what we are supposed to do it. For the cardiology case, I had this one that is just palpation and auscultation. So it was a case of large patent ductus arteriosus. So I examined the patient and I was just waiting for the examiner to come. When I was waiting, I saw a very tall, handsome, smiling, and a flamboyant personality coming with a few people. He was the examiner. He was none other than Professor I.S. Anand. I presented the case exceptionally better to him. You know why? Because I came to PGI after finishing my senior residency at CMC Vellore, that too most of the period in cardiology department under Professor George Cherian and Professor I.P. Sukumar. So I did the case extremely well. Sir was very happy and he started asking questions. And after that, he just left everything and he started asking personal questions. He asked me my name, my family, where I'm coming from, what is my plans and everything. And then finally he gave me shake hand and told me that I am wishing you good luck and all the best for the future. This was the first experience of cardiology in the department of PGI and my first experience with the famous Professor I.S. Anand. After finishing my MD in 1979, I worked as a senior resident in the Department of Medicine for 1 year before joining for DM. I joined DM in July 1980. In fact, there was only 1 seat at that time, and I was the only candidate in that batch. Dr. Bahulian, Dr. Kohli, and Mann were 6 months senior to me, and they belonged to this Jan 1980 batch. And to say about the director at that time, it was Professor P.N. Chotani. I was the director when I joined for MD, and later J.S. Neki became the director. I just want to say a few words about Professor P.N. Chotani. He was very short, very fair, with completely bald. Perhaps he was fully shaven with a shiny head. He had the look of the famous Russian American actor, Yul Brynner. And we used to call him as Yul Brynner. But mind you, I should also say that he was a terror to all of us and also to the faculty. At the same time, he was the most perfect disciplinarian I have ever seen in my life. And I have learned a lot of things from that great P.N. Chotani. Professor Wahi was the HOD of cardiology, both my MD as well as for DM. Now I fondly remember my teachers in the cardiology department. Professor Wahi, the most perfect and disciplined person. Professor P.S. Bidwai, the most quiet and soft-spoken personality. Professor H.N. Khatri, the best clinical teacher. Professor R.P. Sapru, the ever-loving and helping teacher. And Professor I.S. Anand, the most flamboyant personality, and he was very much interested in the researches even at that time. He was an ever-loving friend of all of the students. And Professor Upendra Kaul, the most helpful and the pleasant and the perfect teacher. And I'm extremely happy to say that I am very lucky and I consider it as an honor to be guided and trained by these stalwarts. One interesting thing during my DM training period, which I would like to mention, that is, then there were a lot of candidates from Kerala, both as my seniors as well as my juniors. And to be exact, 10 people were there, mainly myself, Dr. Ramakrishna Pillai, Dr. Jacob Matthew, Dr. Sahasranam, Dr. Bahulen, Dr. Jagan Mohan Taragan, Dr. Raman, Dr. Suresh Kumar, Dr. Girija, and Dr. Suday Kumar. We had a wonderful time in the Department of Cardiology at that time. Now I just want to say a few words of the training at that particular period. I should say that the training for MD and DM was so perfect and excellent at that time that it makes each candidate very confident and in dealing with any type of cases, and they can face any situations independently at a very young age. Here I fondly remember the clinical meetings, the CPCs, the mortality meetings, the bedside clinics, the cath meetings, which all I had presented and also I attended, and the knowledge and the confidence which I gained from them. And having said about this one, I should also mention about something regarding the extracurricular activities which we had at that time. And we had an excellent cricket team. We also had an excellent shuttle team. And every year, the athletic sports was conducted with a true spirit and enthusiasm. In fact, I was part and parcel of all these events. And I used to win most of the prizes in the athletic meet. And my main rival was my close friend, Dr. Pradeep Bambri from the medicine department. My love to him, and I wish and hope that he is doing fine. I don't know about his whereabouts now, but still, I wish him all the best. And another important and enjoyable thing in the extracurricular activities was the interdepartmental cricket matches, which was played with the true spirit. And the main rivalry was between medicine department comprising of cardiology and the pathology department, which was led by Dr. Bhushan. I said this one mainly to tell you that our dear Professor Bidwai was very much interested in the cricket matches, and he used to participate with us in these cricket matches. And just to say about what happened after leaving PGI, immediately after leaving PGI, I took charge of the cardiology department of Samaritan Hospital in Kerala in August 1982. This hospital was a mission hospital run by nun sisters. And I should say that it is at this hospital, the first ever successful cardiac surgery, open heart surgery was done way back in 1972. I'm extremely happy to say that my immediate predecessor in this hospital was our dear Dr. Ram Gopal Singh, who was honored during the last batch. After he had left, there was a gap of 1 year. So I had to work hard to bring up the hospital to the same heights. And by God's grace, I could achieve in that particular aspect. And presently, Samaritan Heart Institute is one among the best cardiac and cardiothoracic centers in Kerala. Here I would say that I have been working there for the past 40 years without any interruption. I did not go to any other hospital. I joined the hospital way back in 1982, and even now I am working in the same hospital. This one particular question people used to ask me, including the doctors, is how come you have been working there for the past 40 years? My answer is very simple. It is a mission hospital run by the nun sisters, and I could do lot of charity work, and I find the satisfaction by doing this one. I'm really contented by working over there, and I want to continue there till, how many years I'm depending upon my health. And during all these years, I should say that my professional work and also my attitude have been guided by what I learned and imbibed from my teachers and my seniors at PGI. Here I remember with gratitude Dr. Ramakrishna Pillai, who used to help me a lot during my MD period. And I also would like to thank all my seniors and juniors during my period for their love and also the guidance and the help. And I always remember with thanks to Dr. Jagmohan Taragan and Dr. Suresh Kumar and Sudhay Kumar, who used to visit my cottage quite frequently before my DM examination to give me the encouragement, the confidence, and valuable support. So to conclude, my memories about the PGI will always remember as golden memories in my life. And once again, I thank Dr. Smith, Dr. Ajay Sami, and all my PGI alumni members for giving me the chance to be with you this evening. My praise for all of you for good health and bright future. Please stay safe and stay blessed. Thank you so much.
Thank you, sir. We do have Dr. Karthik Desai here, and maybe he was, I think, a batch senior to you.
Nagaraj Desai.
Yeah.
Nagaraj. He was my senior, and for MD as well as for DM. He was a close friend of mine, and we used to meet during the conferences.
Yeah.
Nagaraj was very helpful to me. When I joined there, he used to teach me the Hindi, even what I am supposed to take, the history and all, because I was coming for the first time, away from Kerala, and language in Punjabi was really a problem for me. And I still remember the mistakes I used to make while taking the history, and people used to laugh at me. A big hi to Dr. Nagaraj Desai. Hello, Nagaraj.
Hi, dear. In fact,
hello.
Giant and very soft-spoken and always smiling and very interactive. I remember not only him, but of course his very pretty, shortish wife, Valsa. And it was Amitabh Bachchan and Jay Bharti kind of pair. I still remember. and of course, very nice clinician at the bedside and very helpful to the patients. In fact, the atmosphere at that time was more clinically oriented to kind of learn from each other and try and document. And in fact, it was very satisfying when after 10 years also, when we visited PGI department, the colleagues there would remember the notes were visible even in those old case records. That was very satisfying. In fact, nowadays, all the notes are being written in SMS format, and it is impossible to read and understand. Even the angiogram reports are becoming SMS based, reporting. Wonderful. Congratulations, Dr. Ethan. And in fact, we are very proud of you to have stayed in one place and in Kerala, that too, and able to make a mark in the community and the state. Congratulations to you, and thanks to alumni for this opportunity to me. Thank you.
Thank you so much, Dr. Nagaraj, for your wonderful words. Thank you so much. In fact, I'll tell my wife, Valsa, and on behalf of her, I'm just conveying her regards as well.
Thank you.
So over to you, Dr. Ajay, sir. I think Sir has not yet joined. His phone is still switched off. So we can play his video and then follow.
Yeah, there must be. I've been trying to call him.
Yeah. So I tried in between. I think his phone is switched off.
Yeah, even I tried. I think even the WhatsApp is just showing. It is not showing ringing.
Yeah.
So it is probably switched off and just on the cloud. So I think we'll go ahead, Smith. We'll go ahead with his video.
We'll move to
and if he joins at the end. We'll allow him to,
Yeah.
That's it.
So Ritesh, we can play Dr. Bulayan's video and then Dr. Kohli's. So we'll request Dr. Desai and Dr. Koshi to maybe tell us about Sir, because he's.
I know Bogalian. He was my senior in DMs for 6 months. He is doing wonderfully well at present in Kerala. He is one of the best interventional cardiologists, and he is doing tremendous work at Trivandrum. He is in charge of the Anantapuri Hospital at Trivandrum, and he's a pioneer, I should say, in the field of interventional cardiology. And as a person of this one, and my wife and Dr. Bagalian's wife, they are classmates for MBBS, and both of them did MS ophthalmology at PGI during our tenure at PGI.
So I guess there was a direct connection between ophthalmology and cardiology there.
I think
some secret passage.
Right. Dr. Bahulian has been there on many teaching fora across the country over the last decade and a half, and all of us have interacted with him at some stage in our careers, and the amazing thing is the amount of, he has kept up, and he is right at the forefront of importing and employing newer technique. And I mean, he's one of the leaders probably in our continent of the use of physiology and imaging, and his grasp of the basics of physiology is so sound. It's always a pleasure to hear him speak, and somehow we are not able to get him, but I don't know. Let's maybe he will join later.
I hope so, sir. Dr. Miraji Rao has to say something. He's in the chat.
I already sent the message, Dr. Koshi was the senior there, and he just finished his DM, and then he was still seen around in the unit. That is when I joined the unit. I don't know whether he remembers me, but he was my first tallest DM senior resident those days. He mentioned about Dr. Bhambri. Pradeep Bhambri and I are still in touch. Dr. Bhambri is settled in Australia along with Dr. Upjit Kaur. They are doing well. I may pass on his mobile number to Dr. Koshi at a later time. Do you remember me, sir?
Yeah, now I remember you. I think you are a doctor, Sudhay Kumar's batch.
Oh, no, Sudhay Kumar also senior to me. He taught me. I just joined as a medicine resident those days, not as DM resident.
Yes. Now I remember you. Exactly.
I was the shortest and you are the tallest.
The tallest.
Dr. Ajay, we'll proceed with the last video. I have nothing.
Yeah, I think
I could not trace Dr. Mann at all. So I have Dr. Kohli's, but it's a short video because I could talk to him only today morning.
This morning.
That was very late in Virginia.
Right.
So Ritesh, can you play the next? That was in short sir presentation for Dr. Kohli, and he was traveling yesterday, so I could not. This is what all I could get from him. And one important thing that I noted that his hobby still remains farming. So if we have any stories about him, we can share. For instance, my quota of my stock is finished.
Because it's after a long time, because I don't have anything to say at this time about him, because I'm seeing his photos after a period of almost 40 years. Now it's almost 40 years now.
Yes, sir. It was thanks to Dr. Clare that we could trace him. Right, was very late in the program. For the next batch 9, I think we'll start it for previous batch, but this batch also we started in August.
Okay, that's right.
Yeah, but then next again we'll start in January. We'll have it in August. And next class is pending with Dr. Bali sir's class, that and Dr. Surya Prakash Rao's class.
Right.
Next February 4th Saturday we'll try to have that. And as addition, we'll try to incorporate some cases on CTO with our members presenting there.
Yeah, absolutely. I think it's a great forum, and the kind of wealth of knowledge that our seniors have and wealth of experience that they have. The great thing is by exchanging, we can probably all of us get better, learn from each other and get better. And not only about just this thing, maybe clinical anecdotes also, because I feel the great strength of PGI has been the quality of the clinical training that we used to get. I think PGI, it's always stand out from any other postgraduate or super specialty or subspecialty, as people like to call it nowadays, because of the quality of the clinical material that we used to get and the quality of the training as far as the beds, how to bring the book to the bedside. I think that is our greatest strength. We should try and keep that up, although times are changing, and soon we'll probably be interacting with computers and filling yeses and nos for history examination.
Very right.
So, no, I've noted this now in my last 10-15 years, that I feel that probably we are going away from clinical medicine. But it's very odd that, even after doing the angiogram, finally the cardiologist turns up and asks the patient, actually, Baba, aapko takleef kya hai? What problem do you have? After doing all kinds of investigation, you do the angiogram and the MPI and the MRI, and then you come back and ask him, aapko problem kya hai? So that is the...
Actually, there is no time to take the proper history.
Actually, just to kind of, Dr. Swami mentioned it rightly. In fact, other day I had the horror of examining a patient with a left ventricular ejection fraction of 20%, and the family was very worried whether the patient, who is just about 38-year-old, is a candidate for transplant. In fact, you don't believe me when I said that, the blood pressure of this patient was 220 by 120. I was kind of flabbergasted. In fact, I could not believe my eyes. I had to do this unobserved blood pressure recording, as sprint trial has shown us that it is good to be doing it. And I did that. That was the same reading. I still could not believe that there should be something wrong with the machines, because this patient had already seen 2 cardiologists, 1 medical college hospital in our state. Indeed, I did run 24-hour blood pressure monitoring. Please don't blame me for that, because I just wanted to be certain that I'm dealing with hypertensive heart disease and end-stage heart failure, nothing else. Because this patient was diagnosed to have a hypertrophic cardiomyopathy, and the patient having this difficulty, hugely, thick left ventricle and depressed LV systolic functions. Now, this patient, after treatment with all drugs that we have at our command, now his blood pressure is returned to normal, something like, you'll not believe me, 120 by 75/80, and at home. And his left ventricular ejection fraction has returned to normal. In fact, the left ventricular hypertrophy also has regressed. Indeed, I just wanted to be certain that my assessment by echo is good. And I did do left ventricular ejection fraction by RNV, and it was 55%. indicating that just a simple tool like a blood pressure examination, we leave it to the people and we do not care about evaluating ourselves. A patient has heart failure rather than, running after. This patient had, rather coronary angiogram. This patient had, rather the magnetic resonance imaging, and patient had, all varieties of testing, except I don't know why it should be happening in a medical college hospital. 220 by 120. I'll share a couple of slides of his when we have chance to do that, I guess. Thank you so much for your diversion
Wonderful.
of this topic.
Very nice. No, but it is really, it's the learning curve. We should say that. And because nowadays, nobody has got time to take a proper history, proper examination. So that we'll be missing a lot of things because this is happening everywhere. So that should be we should always think about what we learned during our MD and DM time at PGI. And the clinical importance, it is wonderful because, especially Dr. Khatri, Dr. Bidwai, Professor Wahi, and everybody, they used to, teach us like anything. And they used to fire us if we are missing any sort of findings. It's really a wonderful thing that we had at that particular period in our life.
No, I feel
Other
this.
day I had a patient.
Yeah.
Yeah, other day I had one patient who came from a place called Davanagere in one of the towns of Karnataka, where there are 2 medical colleges. Patient was referred for aortic root replacement because they found the aortic root was very huge. Believe me, this patient turned out to have, coarctation of aorta.
My God.
Bicuspid aortic valve.
Well,
And almost about 4 years ago, we did the coarctoplasty by, kind of stenting. This patient is comfortable. And of course, his aortic diameter remains something like, 4 centimeters. And I was kind of flabbergasted again because this patient went through offices of 3 cardiologists, interventional cardiologists. Suffice to say that a good clinical examination probably avoids quite a few embarrassments for all of us. It is not nice to say that your referring cardiologist was not correct, very difficult to, especially if the doctors happen to be professors, in fact. That's the difficulty I have.
Sure, sir. In fact, this electronic medical records and all these things, what I've realized is they make it very easy for the administrators to keep their data and to retrieve the data. It doesn't actually improve patient care. So that is something which I really feel very strongly about. It is the weapon which the administrators use to try and get out the data so that sitting in an office, he can see what is happening so far away just by capturing something, then try and, change the way in which you practice medicine. So I think it's important that we push back against them and show them, what is correct and what is not. And
yeah, even this cut and paste culture of reporting, reporting on prostate in a female ultrasonogram.
Right.
Anyway, we have discussed enough beyond cardiology, interventional cardiology.
So, sir, I think we can end today's meet and wind up.
Sure.
And the next both Saturdays, sir, we meet again. And meanwhile, I'll seek your help, assistance to trace the next batch so that we have more members. We are well prepared.
Sure.
Yeah.
Sure.
Thank you.
That's
Thank you.
Thank you.
Thank you so much.
No.
Thank you. Thank you.
Thanks, Smith, as always, for a wonderful evening. Thank you, sir.
Thank you.
Good
Bye.
night, everybody.
Bye.
Goodbye.
Good night.
Good night.